This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHD, WPHD HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
We are back.
Live.
I mean, we can't believe we never really took off 2 weeks in a row.
I know, John. It was just
it's one of those things.
It was one of those crazy things.
This is like a bicycle. We never forget how to ride it.
You're right, John. And I'm happy to be back live because I'm hoping that our patients are listening and our listeners are listening again live. And I know it makes a difference. I do know that.
It really does. It is another edition of Health Watch Live. We're back in the studio here on Talk Radio 1210 WPHT. Dr. Molly FANTASIA is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi. If you have any kind of a question about a medical challenge or anything related to your health, we encourage you to call in at 855-839-1210, 855-839-1210. It is Health Watch, and we're here most of the time live every Sunday.
We try to be,
That's
yes.
right, from 8 till 9 here on Talk Radio 1210 WPHT. Well, let's get back to what
our
we know.
overview.
That's right.
John? Yeah.
What do you do at Innovative Medical?
Well, I think we're doing more and more, but one of the things I want to talk about is that we are a group of like-minded providers who actually work out of our licensed facility in Marlton, New Jersey. So they all work out of my facility. But the difference between us and most primary care, which we can do everything that any primary care facility can do. You know, if you need a prescription, we can give it. You need some radiology, we can send you out, make the appointment. Actually, we even do better than most primary cares because we have an advocate kind of situation with our patients. So we really try to help our patients get through any kind of challenge that they have in the immediate and also in the long term. But we do this with hydration therapy, and we utilize natural substances to help reduce side effects of the traditional pharmaceuticals.
Why hydration and why natural substances?
Well, why hydration? It's easy. If you know, even traditionally, a lot of pharmaceuticals are delivered IV. If you notice, you go into the ER, especially in weather like this. Everybody's going into the ER, the urgent care. What's the first thing they do? They give you an IV for your electrolytes, these kinds of things. We can do all that. But we like to use natural substances because we know that you get a direct hit. We're able to give you a therapeutic level of a particular substance over time, and we're able to reduce your need for some type of pharmaceuticals. And they include the cardiovascular, the lipid kinds of things, maybe your blood pressure issues, these kinds of things. We're able to really help manage with things like vitamins, minerals, and amino acids.
So this replaces, in a sense,
It can.
the pharmaceuticals.
Or it can help you reduce your amount that you're taking, which, by the way, can reduce the side effects substantially. If you think about it, how many times do you go out of your primary care doc's office with more than one prescription?
Many.
Too numerous to count,
Right.
as they like to say in the laboratory business. And that, my friend, is part of what we do. We look at that. We look at a patient's overall history, their historical use of their pharmaceuticals, and we say, what can we give them to help them? Right now, I'm working with a gentleman who's got a CDL license, which is a commercial license. So his doctor just put him on 2 blood pressure meds, and he's very concerned. And he said, I only have a few weeks to have the blood pressure going down. I said, well, I'll tell you what, stay on those blood pressure meds. Who are we to say, get off of that, Doc? Doc is a wonderful gal. She said, yeah, let him stay on this. She said, but what do you got in the magic bullet to help him? And I said, I do. Alpha lipoic acid, arginine, and I think what will happen is we'll be able to reduce his blood pressure more quickly than even the pharmaceuticals work, or in addition to the pharmaceuticals.
And how many treatments would that be?
He's
what
been
you
a long
define as more quickly?
He's been a long time patient. So I think in this case, probably we can get it done in the 4 weeks he needs if he comes in the 2 times a week, in addition to his blood pressure meds. I think we can get him right in that sweet spot. So that's the answer. In other words, we're not telling you to get off your meds, but ultimately, I bet you he can go down to 1 blood pressure med. And
that's what the goal is that
correct,
you always have.
Correct.
Reducing medication.
Exactly, if we can. And the other thing is we want to enhance your quality of life because we just don't want you to have the side effects of all of these meds if it's feasible and we don't put the patient in medical risk. It's always risk versus reward.
Every patient who comes to the initial consultation says to you, well, Dr. Molly, it all sounds terrific, but does it work?
Well, the only thing I can say, John, is I have the data to show that your lipids can be reduced. I have the data to show that your blood pressure can be reduced. I have the data to show that you may have some improvement in your cancer journey. I have the data to say we can help you get out of some pain using the pain scale, people with fibromyalgia, chronic fatigue. I have the data to show that we reduce your inflammation markers if you have an autoimmune rheumatoid type disease. So there are many things we can show you, but the most important thing is come in with an open mind and talk to our patients. Because I'm going to tell you, John, I have a group of patients that are all thinking people. They think out of the box, they're highly functional, and they'll love to talk to you about their experience.
And you also have a radio host who you've kept alive
for
20 years.
Yeah, well, the good Lord kept you alive. Let's be honest. We're just a vehicle by which we can get you to the right stuff, as they like to say.
How many treatments realistically could a patient expect?
Well, we can see improvement in as little as 5 weeks, but I think in order to have permanent change, you're probably going to need somewhere between 10 and maybe 15 weeks. It depends on how often you come in, the severity of your problem. I mean, obviously, one of the things you and I talk about almost every weekend when we see each other in the clinic, which is often, we talk about why don't people come in earlier to see us, where we can effectuate the change more rapidly. No, you wait till you're like on death's door and then you come in and, as I say before, it's not holy water, John, but it can really help.
So the whole goal is to reduce the side effects
of medication,
prescription medication.
Increase your quality of life, right? And depending on whether you have a chronic condition or not, reduce some of the symptomatology of that condition that impedes your quality of life.
And are there any side effects with the natural substances?
Of course you can have side effects with the natural substances. That's why it's important to come to a place like ours, a medical hydration clinic, because, again, we're going to look at your entire history as well as present laboratory results, things like that. I encourage people on the free consult to bring in their data with them so that we know what can we do. And the other thing is, I would tell you that our staff is pretty well versed with how to handle any type of problem should there arise one. But I have to tell you, John, I'm there 27 years in October. I can't even say it, actually. 27 years in October. And frankly, the side effects that we've seen have been so minimal. Maybe a little drop in blood sugar, maybe a little, feeling that most people feel pretty good after the IV. And usually it's just maybe a little anxiety about having the IV inserted.
Yes.
That's really a big issue.
I want to touch on something that we've talked about many times, where people just go to the health food store and buy stuff.
Wrong.
I mean, they buy stuff and buy stuff and buy stuff, and it's many of it counters everything else.
I just had a case like that before I left for the conference, okay? This woman brings in 2 shopping bags full of stuff, and repetitive. In other words, she's got 4 categories of goods that are all doing the same thing, and some of them are interacting with each other and certainly interacting with her medication in addition. So, yeah, this is what I mean, John. You can go to the health food store. There are plenty of things in there that are good, and you get in there. We'll help you with brands as well. But the objective is to really help you reduce what you're spending over there and getting the appropriate things you need and working with this cohesively with what we're doing.
Your nurse Barbara is an expert.
Oh, my gosh. She is incredible. She could write the book on certain nutraceuticals. There is no question. Listen, she went for her eye exam, and her doctor told her, I don't know what you're doing, but your eyes have greatly improved since you were 60. Now, I'm not giving away her age, okay?
Yeah.
But let's just say she's 60 plus. He couldn't believe it. He could not believe it. So all the things you hear about, you're going to get, macular degeneration, you're going to get AMD, all these things. You know what? She is a testament to keeping yourself together.
She not only tells you what to get, but she tells you what aisle it's in.
I know. That's a side.
So
this is what we do. I mean, we like to be involved with our patients, and I think for the most part, we really try to be.
We are coming up on our first break of the morning. It is Health Watch, and we are back here live on Talk Radio 1210 WPHT. Health Watch is here every Sunday, 8 until 9, and we are ready to talk to you at 855-839-1210. That's the number here in the studio. If you have a medical challenge that you want to run by Dr. Molly, or you have a specific thing that you want to ask her about, well, then pick up the phone and call us, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are coming back. Dr. Molly and I are coming back with more of Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates, and you can call them up right now, 856-489-0505. Again, 856-489-0505. And when you call, you can get some information, that's fine, but you really want to make the appointment to sit down with Dr. Molly and go over your situation, and she'll tell you what is involved in all of that you have to do. 856-489-0505, the number, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And again, the number here in the studio, if you have a question or a medical challenge, 855-839-1210, 855-839-1210. And Dr. Molly, we weren't here the first week because you were at a conference and you were speaking right at the time that the radio show was.
That's right.
Talk about timing.
It was bad timing, but good timing.
Yes.
Because it was a great conference.
So you want to start here, and again, it's about cancer as a metabolic disease.
That's right.
So let's start there and let's see where we progress.
Thank you, John. You know, we started that 2 weeks ago prior to my speaking at the LDN conference or the LDN Trust conference. But one of the reasons why I wanted to talk about cancer as a metabolic disease is you realize that we know in this country that 90% of all cancer deaths are due to the spread or the metastases of a primary tumor. Well, many times people have the surgery for the primary tumor. So why does that happen? If the tumor's out and margins are clear and all these things are great, what is going on? Well, because back in time, we get a hit that it's a genetic disease, right? But I keep thinking to myself, what about these women who have breast cancer who are not BRCA positive? They're not BRCA positive. So they don't have the genetics for the particular cancer, but they end up getting the cancer, and they have the mastectomy, and they do all this. Well, that's what got me thinking about metabolics and cancer as a metabolic disease. And lately, that has come to the forefront in many oncologists' minds, all right? But what's happening is across these cancers, we have to recognize that as a metabolic disorder and then unravel this in a way for the treatments. Now, that's one of the reasons why immunotherapies came out, and that's something I touched on 2 weeks ago. So despite the progress of understanding cancer and cancer burden, we realize that it's ultimately the spread of this. And why does that happen? Well, because we have metabolic stressors, which means that there's a dysregulation in our biochemical processes that is causing this cancer to return with a vengeance. So how do we address that? Well, You can address it with the chemotherapy, you can address it with the immunotherapies, and you can also address the supportive therapies you need through natural substances. Why? We've got to put out the fire, John. Put out the fire.
Okay, before you go any further, what do you mean when you say cancer as a metabolic disease? What exactly does that mean?
Okay, I'm saying that the cancer itself can be eradicated if you can eradicate some of the inflammation. I'm always talking about inflammation. And when you think about this, that's metabolic stressors. Inflammation is metabolic stressors. So what do? We have things like the anti-inflammatories. We have things that can balance out the hormones. And by the way, these are both traditional as well as natural. But that's what I'm talking about. When you really think about it, again, if you remove the initial tumor, why are we having this spread? What's going on that we have this spread? So it's a different way to look at cancer, and it's been in the making for quite a while. One of the very first articles that I ever saw looking at this was Cancer as a Metabolic Disease in 1927. 1927, okay, Dr. Warburg, W-A-R-B-U-R-G, reported that cancer cells manifest a unique metabolic phenotype, which means a subtype of the cell, characterized by enhanced consumption of glucose compared to normal cells. So, what's the first thing I tell all our cancer patients? You know it.
Stay away from sugar.
Amen. Amen. So his observations gave the notion that cancer has a metabolic component, not just a genetic.
You know, you were saying something earlier about women with breast cancer, but how many times have you heard people have lung cancer? They never smoked.
That's right. That's right.
I mean,
So what triggered it? Well, could it be that we had secondhand smoke that triggered inflammation, that started a metabolic problem, and then our diets don't support good eating, don't support low glucose? I mean, there are so many things when you look at this. People who are, maybe it's some of the drugs that we're taking for other conditions. So the metabolics is extremely important, and one of the things that I want to talk about today is the use of repurposing traditional drugs in cancer care. That has started to be a big deal. And why? Because it works on the metabolics of cancer. So again, we as a group, and one of the reasons why I was asked to speak, and by the way, that's a whole other deal. I mean, you know, I was asked to speak at this conference, and I was humbled to be there with all of these wonderful integrative physicians who were interested in what we were doing, because it's a little different than many of them using in functional medicine, because of the way we deliver our nutraceuticals and have a game plan for our patient that may go 10, 12, or 14 weeks. So the insight that I got is the biology of the cancer cells has caused us to not have many effective treatments against it. We know that some of that has to be done with nutraceuticals, diet, and sort of becoming aware of our surroundings, the environment, all of these things. So it's quite interesting, John. Your question is good. So really, I think we're going to find new avenues of treatments that are coming out, maybe under the immune treatments, but I'm not sure, to help reduce inflammation in the cancer journey.
You know, this thing is so interesting,
and
it
complex.
Can go so many ways. And I know after the break we're going to talk about your conference and your speaking, but what's the bottom line here? What did you come away with?
I came away with an old thought I had about cardiovascular disease. I said, just because mom and dad had it and you claim you have the genes for it, you don't have to let those genes run havoc in your life. You can help suppress them. And how do you do that? By diet, by taking in the right nutraceuticals for these kinds of things, by looking at exercise, looking at oxygenation, you know, keeping that oxygen flowing head to toe. So I came away with an understanding from the conference in total that way, that we need to, at least in terms of our clinic and in terms of functional medicine, we really have to look at, yes, not just the genetics, but the epigenetics of a patient. And what do we need to do to help that patient reduce the risk of metastasizing the original tumor? And when should that come into play? Earlier is better, right?
You said it.
Earlier is better. So I think that we really need to say that although the traditionalists are looking at the mutations and the genetic alterations that are common to many cancers, and I applaud that because many of my colleagues are doing just that and developing new drugs. I say that the theory of metabolic disease needs to be addressed because it's in the metabolics that we can aid in your cancer journey.
You know, this is so fascinating, this discussion. And I wanted to ask you, when it comes to cancer, is there anything that you would recommend before we get it that we do?
Heck yes.
Diet, exercise, of course, no cut down sugar.
Cut down that sugar, and I mean all sugar, not just complex white sugar, but definitely that, right? I think we want to look at our vitamins that we're taking and make sure that the brands are good. Make sure they're not loaded up with junk that affects the liver. I want to look at all kinds of anti-inflammatories. I would tell people get in the chair at places like ours, medical hydration clinics, so that we can do a complete blood work on a patient and see. And also, let's take a history. Let's see if there's a genetic component to what you have, and can we reduce the genetic risk by putting you on a good nutritional supportive program. Those kinds of things, John. And I think very important too is looking at the stress levels that many of our patients have. And unfortunately in the country today, we have a lot of stress, John.
Oh yeah.
And so that also adds to the problem that can cause our metabolism to go haywire.
You mentioned genetics before, and I thought about it. I've had a couple of bouts of cancer.
I know you have.
My mother and father never had it. I mean,
know that.
never.
I know that.
So how do I?
Metabolically, but think about the work you did your whole life.
Yes.
You were in radio.
Yes.
And radio is a stressful business, and particularly the time you went into it, right?
Yes.
Also, I want you to think about our circadian rhythms, right? We're supposed to get some good sleep. I believe you worked overnights. I believe he's shaking his head. Yes, you can't see it, folks. But all of those things contribute to maybe why you got this, right? And the fact that you were always out on calls, you're making sure that your clients were serviced. These kinds of things get to you, John.
Yeah, they do.
I mean, bottom line.
We are at the halfway point of the show, which means we still have plenty of time to take your calls. And we always tell you, call now. We can have some time to talk to you rather than calling at the 3 minutes before 9 when we got to get off the air. 855-839-1210 is the number here in the studio. 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Like I said, we're at the halfway point of the show, and we got plenty more to talk about here. Dr. Molly's going to talk about the conference that she went to a couple of weeks ago and more. 855-839-1210 is the number. I'm your host, John DeMasi, with Dr. Molly Fantasia. We are both returning with more Health Watch after these words. 856-489-0505 is the number for Innovative Medical Associates, and operators are standing by right now at 856-489-0505. When you call, probably the best thing you can do is schedule the initial consultation with Dr. Molly. It is complimentary, and you'll really find out a lot about what she does and how potentially she can help you. So give her a call, 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. So check that out. innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Before we get back into what Dr. Molly's going to talk about, we're going to go to the phones and talk to our favorite, Frank.
Must be Frank.
Frank in the Northeast. Frank, good morning. Welcome to Health Watch.
Hi, Frank. It's good to hear from you.
Used to. Good morning. I said this before. Remember that popular TV sitcom, Welcome Back, Kotter?
Yes.
Yes.
Welcome back, Dr. Molly.
Thank you. Thank you.
This is
Thank
Arnold
you.
Rorschach. I called up Dr. Molly with a question of mine, but I heard you mention about the genes. They can be suppressed.
Yes. Sure.
So I got to ask you two questions, if that's okay.
Sure.
Ooh, that's my Arnold Rorschach. The gene, when you have a genetic mutation, you have genes, you can suppress them. It doesn't mean they have to be present.
Yeah.
But in my case, they've already been expressed already out there.
Right.
Can you put them back in the bag?
That is really a difficult thing, but the short answer is yes. But the time frame, you know what I mean, Frank? Frank, that takes a lot of work on your end too, because you can't really give all of the nutraceuticals and all of the natural products. And maybe what I'm going to talk about in the next segment is really one for you. The use of LDN or low dose naltrexone in a case like yours, it takes time, because what you have to do is we have to really look at helping suppress the cell signaling that's going on, which I know you understand since you were a registered nurse. The cell signaling is what's really causing the problem. In other words, the gene has expressed, it's sending out signals that are causing you to have havoc all over your body. And this is really a very tricky thing, because too much is no good of both the subclinical dose of a particular repurposed drug, and too little is no good, and the same is true for the natural substances. So yes, the short answer is, can we help? Now, that doesn't mean, Frank, I can get you to walk on water. You know that. But I do think there's some hope out there for you. Absolutely. In fact, it's interesting. You're one of the guys I was going to call next week when I get back in the office, because I think there's some hope here with the LDN. So it would
Dr.
be
Molly,
interesting.
I did try the LDN. You gave me that.
I remember. But since then, there has been so much new data, my friend.
Okay.
So much new data. And you have an open mind. Let's try what we can for you. Okay, Go ahead.
The first question, which became my second question.
I'm so sorry.
I was talking on someone last week, Dr. Sean Amara. He's up in, I forget where he's at right now. He's on the radio. Yeah. He said my problem should be visceral fat, to get rid of visceral fat, and I should be okay. What's the best way to get rid of visceral? I mean, can you spot reduce this visceral fat, or you mentioned the carnivore diet?
Oh, I think the best way, listen, I don't know the good doctor who you were speaking with, but I think visceral fat is a problem for everybody. One of the things that we're encouraging fasting right now. And again, the data has supported, certainly for certain conditions, including the cancer conditions, and maybe even in yours, you try to do a 12 to 14 hour fast. And actually, I believe really 14 hours is what I would say the gold standard. It is hard to do, though, Frank. Very hard.
I'll tell you what, before I let you go, I do that without even realizing I was doing it. But I do 14 hours pretty much every day anyway. So I've been doing that for at least a couple of years now.
I believe you. And I would say to you that that's probably why at least you're as functional as you are. God bless you, Frank. I mean that. Well, but really, we should get together, in person and talk about a couple of things, Frank.
I'll do that. Just give me a call next week whenever you're ready.
I will. I definitely will. God bless you,
Frank.
To both of you. Thank you.
Thank you. Thanks for the call, Frank. Appreciate it. 855-839-1210 is the number here in the studio, 855-839-1210. And if you have a question for Dr. Molly, feel free to call us, and she'll run by your medical challenge with you here on the program, 855-839-1210. So a couple of weeks ago, Dr. Molly was not here, and I wasn't here, and we were running a tape because she was speaking at the time. Talk about timing. You were speaking at the time that your show is normally on, the LDN conference and the uses of LDN. Want to talk about the repurposing of traditional pharmaceuticals?
Right.
That
is really, I would tell you, so I was invited to speak at the LDN Trust Conference, and I urge everyone out there who's listening to me, please go on LDN Trust on your computer and look at the uses of LDN today and what's going on in the community of people, the marvelous physicians who are using this. But more importantly, I want you to look at the patients who are using this and the results that they're getting. And I want you to know the reason why we were asked, or I was asked to speak there, was because of the data that I was compiling showing that the way to use the LDN, we use it in a tincture, which means it's right under your tongue. And we're using it in conjunction with certain protocols that I use for cancer, MS, fibromyalgia, for the chronic pain conditions as well. But I want us to focus in on repurposing medications for the cancer supportive treatments because that is so important. And it's becoming more and more important today based on the facts that using these repurposed medications can help suppress some of the cell signaling that's going on in these cancer in this cancer journey by interfering with it and modulating and modifying the immune system. So I really think this is important. And the way that we are using it, let's say that you have a particular cancer protocol. So am I using everything to help the metabolics? Of course I am. What am I using? John, your favorite thing, vitamin C.
Yeah.
I'm using things like DMSO to deliver these things. I'm using things like certain B vitamins, not all of them, but certain B vitamins that we know work for the cancer journey. I'm using alpha lipoic acid. I'm using several other things, but I'm also using subclinical doses of LDN and actually of an anti-diabetic drug. And it's becoming more and more used within the framework of the cancer protocol. And again, it's because we're looking for those metabolic alterations, not the genetic. We know if somebody comes into me and they have breast cancer and they've tested positive for the BRCA genes, well, we know they have the mutation, and the mutation more than likely started the original cancer site. But why does this darn cancer spread? Right? There's the answer. We've got to stop the cell signaling that makes the metabolics go haywire. And there are ways to do this by repurposing these drugs. And we're using them, but it's how we're using them. We're able to utilize this in a way to really keep track because why? My patient comes in once a week. There's no downside to what we're doing. I have to tell you that this new avenue of treatment, as far as we're concerned, has made a difference not only in our cancer patients, but across the board in what we're using when we have inflammatory markers and people who are out of control on certain other conditions.
You were telling me that you were at this conference and there was a lot of people who do what you do, of course. But you kind of stuck out because you're really...
Of how we're doing it. How we're doing it.
The hydration and the medical
they're doing functional medicine. They're seeing their patient. They're putting them on the diets. They're telling them what vitamins to use. But we're getting a very big bang for the patient's buck because we are actually delivering specific nutraceuticals for them after reviewing their cancer markers, all of these things, and we're able to utilize the specific things we need. Plus, I'm able to be involved with our patient on an ongoing basis. John, there's not a day that goes by I don't walk through that clinic.
Oh, I know. I
and
see it.
say what's going on, and there's not a day that goes by that I probably don't touch base by email or whatever with my consulting oncologist and sort of give an update on what's going on within the framework of the clinic, as well as my medical director, who, by the way, didn't know a thing about LDN. And her case was one that I presented because she has MS, and she's made a tremendous recovery with the neurodegenerative diseases. And I'm telling folks out there, the complexity of how this LDN works is too much to go into in a radio show, okay?
Yes.
And believe me, all of these physicians went through all the biochemistry of it, this, that, and the other thing, and then they get to me, and I say, okay, all of that is wonderful. In theory, it's all great. How are you guys doing it in practice? Well, you see, Molly, then we have a little problem. I said, well, wait till I get on. And they were like mystified. They said, you know what? You're right. In other words, utilizing these drugs within the framework of delivering a therapeutic amount of the natural substance makes a huge difference.
You were talking about a lot of the people were focusing more on the spa aspects.
Oh, yeah.
And why is that questionable?
Listen, you want to utilize things in a medical hydration clinic because there are other things we can give you. You can go to a spa and get vitamin C, but you're not going to go to that spa and get a course of LDN. You're not going to go to that spa and have someone sit and talk to you about the enzymatic activity of healthy cells and saying the data that was out there that was done from Dr. Gonzalez years ago showing that high levels of enzymes can also help the cancer cells not to survive because the enzymatics cut some of the cell signaling. In other words, there are limitations in going there. Yeah, I don't have a problem. You want to go and get a couple IVs at a spa, I have no problem. What we do is we actually have a team approach to put together a protocol for you, and that's the difference.
When I go to a spa, I get a massage.
Yeah, or a facial. That's good.
Right. That's all good. I care about.
I think that's wonderful. But our situation is we want to get a handle on your condition and improve your quality of life by really inactivating certain things that are causing you to have these problems, whether it's pain, cancer, or a combination. We want to target those things when we're doing our treatment protocol.
You talked about repurposing traditional pharmaceuticals.
Yeah, LDN being one of them. Low-dose naltrexone. Naltrexone's used to what? Reverse opioids, okay? But imagine we're using this in such a subclinical dose that it has a profound effect on modifying the immune system. So it's a wonderful thing. We use things like metformin. And in the use of these kinds of drugs, we're able to look at, okay, how is this working? Okay, well, we want to cut down the sugar. We want to cut down possibly the glutamine reaction in the body that really promotes growth. So there are many things that we want to use. I'll tell you another thing. Go to a spa. Make sure they're not, if you have cancer, don't have glutamine in your bag. So, which I don't think they'll have anyway, okay? No. But if you're working out and you're a healthy guy and you want to put on some muscle mass, maybe you want to do a little glutamine. Okay. So, again, it's how we use everything, John.
We are coming up on our final break of the morning, which means that we still have plenty of time to talk to you at 855-839-1210, 855-839-1210. That's our number here in the studio. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, 855-839-1210. Dr. Molly and I are both returning with more of Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates. The number, 856-489-0505. That's 856-489-0505. And, of course, they will be there well after we leave you at 9 o'clock this morning. But if you want, it's on your mind, call now and make that appointment with Dr. Molly for the initial consultation, which is complimentary. Again, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, we have a replay for you at 4 o'clock this afternoon, the Health Watch replay, 4 until 5, right here on Talk Radio 1210 WPHT. Before we get back into the show, we're going to go to the phones. John is in Bucks County. John, good morning.
Hi,
welcome
John.
to Health Watch.
Hi, good morning, Dr. Molly and John. Love you guys. Dr. Molly, I was a patient of yours. I don't know if you remember me. I'm the pharmacist.
Yeah, I remember you, John. How's everything going? I hope well.
My back's great.
Good, thank God.
You helped me immensely. I was calling about my mom. I think I spoke to you about it before. She has vascular dementia, history of stroke, and I'm moving around independently. She's in a memory care place, but she went from moving around to she just had a stroke, and she's now in a wheelchair. And She still knows who we are. She's able to swallow fine, but she's got the left side where it's pretty much it's going to be an uphill battle.
Oh,
so I heard you. I just turned you on because I'm taking my son somewhere, and I'm like, you were talking about LDN, and I know about LDN, so I was curious. She's got tremendous anxiousness, and depression, post-stroke depression.
Sure.
And they wanted to put her on an SSRI, which I wasn't. I told the doctor that I'm concerned about the bleeding aspect of the SSRI. Being a pharmacist, I always think like that.
I think that's right.
So I said, I know they inhibit platelets. She's on drugs that inhibit platelets. So I'm wondering, first of all, I want to get her better in her brain and her left side.
Sure.
So, and I know LDN has been used for depression.
It has.
But I'm not well versed as you are. And she does have stage 3B kidney dysfunction or condition. So I didn't know.
John. Yeah.
I wish she lived right around the corner.
I know that. Hey, John, though, you know what? Why don't I give you some of the data that I took back from the conference, because I do believe your mom could go on a very low dose, and since you're in the compounding business, you could probably do this in a way that the delivery system would be easy for her, you know? She's got no trouble swallowing, right? None? She can swallow a little bit?
No, she swallows fine. I mean, they're telling me she's spitting out her pills sometimes, but I think it's just because she's just anxious.
Yeah, of course.
She always was no problem of taking medicine.
Oh, you know what? You could make the LDN in a tincture, and you probably could do it in a way that you could control the dosing. In other words, you could go up from as little as 0.5 up to 1.5 on ml, I'm saying. And then if we delivered it, and I certainly will bring Pat into this, but I feel like if we can deliver this in a way, you can put a very small amount, and it may help you with both the anxiousness and also help her just feel overall a little better, you know? I definitely will get you the clinical study on that, John, you know? Would you do me a favor and call me on sometime early next week, and I'll get your address and everything and get it all out to you, or we'll email it to you if you give me your, you know, actually, if you,
awesome.
You know what?
I want to bring her there, but
I would love
to. We're so far.
I know.
And now I got to figure out how to get her from the wheelchair into my car.
Sure. I know that.
It's heartbreaking. I saw her yesterday, and they had her in a recliner, and I was like, I didn't even wake her up because I was like, I was in tears.
Oh, my God. I know it, John. I know it. It's your mom, you know. My God. Yeah. If you can do anything, and you're in the business, I really want to help. If there's anything we can do, I will definitely help you, and I'll get the information to you. Email me your email address to ivdocs, DOCS, at AOL.com. Same email, please, and I'll make sure you get some of this, and then maybe we can chat about it if you put your phone in there, okay? You're always a good guy.
Awesome.
I love pharmacists.
I love you.
I love you too, buddy.
I was telling my son, I was like, you know, the conventional approach, I get it, but they're not looking at it.
That's right.
They need other ways to help these people.
Listen, look at our John over. I wish you could look at our John post-stroke, okay? He's doing great, and may God bless you, awesome. John. Okay, take care, my friend.
John, thanks for the call, and Molly will follow up with you.
Oh, yeah. Listen, you know what, though, John? I want to say one other thing. First of all, I do remember John very well.
I remember you talking about him.
We used some peptides for him, but I will say this. The thing is, he's trying to be proactive, and that's the important piece. Let's become proactive in our health. You know, his mother is, I'm sure she's probably my age or maybe a little younger even. The thing is, you know, there are so many different repurposing of these drugs today. The potential is just out there. I mean, when I look at cancer supportive care that we did 10 years ago versus today, I'm like blown away myself. And it's really through the help and the grace of God that people are doing so much better. And as I say all the time, he's the true physician. He's the medical director as far as I'm concerned. Dr. Pat's number 2, but he's the medical director as far as I'm concerned. And I do believe that after coming back from this conference and actually speaking in this conference and really seeing the reception I got, because these guys and gals were really trying to do functional medicine, but of course they're limited in their scope of practice just based on what they have to do to make a living. I am very lucky that we put this together from the very beginning, knowing that we wanted to have a fully functioning facility that was doing this and delivering the nutraceuticals in a way that we knew could help the patient.
And 27 years later, you're still doing it.
We are. I mean, and I do believe all the time there is improvements. The thing about this medicine, John, is just like everything else. You can't rest on what you did in the past. You take the data that you have in the past and then you digest this and say, what can I do to improve upon this? There's always something new. I like to say there's always another bus. And I learn as much from the patients. By the way, at this conference, there were a ton of patients and their stories were blowing me away. How they suffered for years with pain. And they just couldn't get a handle on this. And finally, some brave primary care doc would take the leap and at least order something for them, like in a repurposed drug. That's wonderful. Suffering from years with cancer supportive care that wasn't working, right? Because they were going to a place where they're just getting, vitamin C. And I really know that there are things we need to do. Vitamin C alone will not help a patient. We need to look at all of these things that I was talking about today.
Wrapping up the show, we got a couple minutes left. What did you want to say about what we were talking about LDN and the uses and the repurposing of drugs?
I would say not just the LDN, folks, but for example, in our cancer supportive therapy, depending on, as I said before, every patient I've ever done in the clinic who has a cancer problem tends to have a viral problem. They have antibodies to CMV, which is linked to chronic fatigue, fibromyalgia. They have HSV, these types of things. So guess what we use? We can use a traditional antiviral drug in a subclinical dose along with natural substances like lysine, melaleurin, these kinds of things right in their IV as we're looking for the anti-inflammatory effects, because the body cannot fight on so many levels. Let's face it, we're only human. Yeah. So these are the things I'm talking about. Utilizing a medical hydration clinic and knowing that the therapies can do more than just the spa-like treatments.
We certainly learned a lot today from this show.
I
know I did. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. Call and make that appointment with Dr. Molly for the initial consultation, and you'll really learn a lot, as we did today on the show. 856-489-0505. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, and Vicky. And then, of course, there's delightful Dee, Joanne, fabulous Fran, and our medical assistant, Sandra. I'm John DeMasi. Thank you for listening. Don't forget, we're on this afternoon again, 4 to 5. Health Watch comes back next week, the live version, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.